So hi everyone, my name is Franz Jasmine Swaner-Yag, your second year student nurse from Davao Doctors College. And today I am going to perform the demonstration of the newborn care. So newborn care is which defined as the management of neonate and of course the subsequent period of stabilization. So wash your hands prior from preparing the materials needed such as the cotton balls, the sterile gloves, the umbilical clamp, the bonnet, the forceps, syringe, the measuring tape, the vitamin K, the Hepa B, the BCG, and of course the operating sponge and the ophthalmic ointment. So afterwards, identify the infant by properly looking at his or her name or wrist tag to identify the infant's identity. So enhance the infant's comfort by keeping the environment warm to prevent heat loss that may result to hyperthermia. And of course, perform hand washing before doing the procedure. Then afterwards, weigh the newborn correctly so that we will have our baseline data. So now let's proceed to the cord dressing. So this procedure helps us to prevent infection around the baby's cord stump. So put the sterile gloves, then properly restrain upper and lower extremities of the newborn using the operating sponge with ROH. And disinfect the cord 3 times from base upward to hold the baby in a place. And to gain the proper access of the cord and also to protect the cord from contamination. So now, put the sterile OS at the base of the cord and clamp the cord with a umbilical clip 1.5 inch from the base of the cord. So now, clamp and cut the cord using the plastic clamp about 2 cm from the base. After pulsating, stop with within a 1 to 3 minutes after birth to prevent anemia and intravascular bleeding. So OS placed on the base of the cord. Now cut the cord about 0.5 centimeter above the cord clip and expresses the remaining blood from the cord with the OS placed on the base of the cord. So now, place the OS at the base of the cord stump and pours 70% ROH over the cord. This is to ensure that the remaining blood is stuck within the cord of the baby and to provide the most optimum conditions for healing by removing remaining debris and contaminants from in and around base of the cord. So now let's proceed injecting the vitamin K. So this is needed for the blood clotting to prevent a serious disease called hemorrhagic disease of the newborn. So now let's withdraw the exact amount of vitamin K from the ampule and inject into the middle third lateral aspect of the infant's thigh. So now let's inject the hepatitis B vaccine, about 0.5 ml of intramuscular. So assuming that this is the hepatitis V vaccine, then now let's inject the BCG vaccine, about 0.1 ml, into intradermal, right deltoid. So now assuming that this is the BCG vaccine, so the lateral aspect of the infant's thigh is preferred site for intramuscular injection. So because it is the most or the bulkiest part of the thigh, so this is to provide protection against the hepatitis B virus or the HBV right away, and vaccine given to babies to protect them from serious forms of tuberculosis and miliary tuberculosis. So now let's proceed to initial bath. So hold the newborn in a football grip manner, folding both ears to maintain the comfortable position of the baby and prevent the water from entering through the ears. Then carefully washes the newborn's head with the use of baby soap or mild shampoo and wipes dry thereafter. So the baby soap and the mild shampoo are preferred for babies because they are unlikely to cause irritation to baby skin. So now put on the baby's diaper, shirt, mittens, and booties. So diaper are given to absorb and hold the baby's waist, while the mittens and booties protects the baby's finger and toenails from the trauma and to prevent the baby from scratching his or her face. Then wraps the newborn securely in a clean blanket to maintain the warmth, and of course place the newborn in the crib with the drop light on and attaches the crib tag. So because the crib contains infant to prevent falls, while drop lights maintains the warmth of the environment. So assuming that this is the name tag. So now let's shades the newborn's eyes from the light and then open one eye at a time by exerting a gentle pressure on the upper and lower lids to protect the infant from eye infection or the ophthalmic neonatal. So now apply the ophthalmic ointment from inner to outer canthus. So assuming that this is the ophthalmic ointment, so making sure that the tip of the medicine tube will not touch the eye of the newborn. To follow the principles of starting from an area furthest from you and takes the newborn vital signs, because vital signs are good indicator of newborn's adoption and survival, such as the temperature, heart rate, respiratory rate, and saturation. So now, of course, lastly, do the aftercare to maintain the cleanliness and record the procedure done and the other pertinent data. So this will serve as the proof that the procedure was done and the communication among the professionals of the health system through the exchange of the information that concerns the patient.